Hello, Pulmonary Rehab. Julia O'Shea, respiratory therapist, here to share with you part 2 on the oxygen therapy lecture. So this second part is a little bit longer, so which is why I broke it up into 2 parts. So this information is important. It's probably more applicable if you are currently on oxygen or your doctor feels that you need to start oxygen. Either way, it's all good information, and I encourage you to watch this video in its entirety. And I will do my best to cover as much as I can. We will also be having a lecture on traveling with lung disease, so there will be additional sections related to figuring out how to travel by plane, train, automobile to get you to the places you want to go. All right, let's get started with our PowerPoint. Okay, so here we go. All right, so say you are at your doctor's office and they check your oxygen levels, and for whatever reason, maybe they're low, or maybe something came back in a CT scan or your spirometry, and your doctor wants to test you to see if you need oxygen, maybe when you're sleeping or with exertion, things like that. So the it's not a diagnosis, but just the whole treatment or therapy of oxygen, we never know how it's going to come into our lives, and when it does, it's pretty much guaranteed that it catches you by surprise. So most people go through almost like stages of grief, where you are initially shocked, you go through denial, you might eventually accept it, but then there's also periods where you just don't want to wear it and you feel like, I'm okay when I'm sitting still, so maybe I won't move around that much, and that's actually the worst thing you could do. We want you to use your oxygen and move around. But my point being is that it can be really hard to process what's happening when your doctor tells you that it's time to use oxygen. And the other thing to understand, that with lung disease, that is part of what our lungs are designed to do. So if you have lung disease, there is a chance that there might come a time in your life where your doctor tells you that you need to use oxygen. So if that comes into your life, the big thing that you should take into consideration is, what do you want to do? And what I would encourage is that you continue to do everything that you want to do. Don't let the oxygen stop you. That is very, very important to understand. And if you feel overwhelmed, confused, you're not sure what to do, there are resources out there. So reach out to me, reach out to the pulmonary clinic, your doctor. Let us help you figure out how to get you doing what you want to do. So something you might want to ask is, how long or how often do you expect to leave your house? Because those are things to take into consideration depending on your system and how either how much oxygen is available or how much battery life is available. Are you going to be staying overnight places? And if so, how often? What hobbies do you like to do? And then figuring out how to adapt these hobbies so that you can carry your oxygen with you. And then if you're working or volunteering anywhere, what will that look like? Okay, so choosing a vendor. And when I say vendor, I mean a DME, which is a durable medical equipment provider. So in Vermont, at least in Chittenden County, the 3 main ones are, there's Lincare and Apria, which are the 2 national companies. And then we have Keen, which is our local company. It can be slightly easier If you plan on traveling a lot out of state, maybe you go to Florida for part of the year, whatever it may be, it can be easier to choose a national company. Not to say that the local company can't support you, but they just have to make arrangements with another company wherever you travel to. So that's question number one. Are they national, especially if you plan on traveling? What systems do they have available? Because they're not all the same. They all have different types of equipment. How often are they delivering? Will they help with travel plans? What's the response time in an emergency? So on and so on and so on. So you can see you have this list of questions to take into consideration, all that are very important. And so I'll try and touch on these as best I can. And again, check with your providers, because there are resources out there to help you navigate this decision. Okay, so Medicare. Most of the people who I work with are on Medicare, and generally speaking, they kind of set the guidelines that other insurance companies follow. So they pay for 80% of the costs, and then if you have a secondary insurance, they cover the other 20%. And this is where people get a little tripped up. So I'll try to explain this as clearly as I can. It doesn't make a big difference to you. The only thing to pay attention to is that if you want to switch your company, it's much easier to do it sooner than later. So basically how the vendor gets paid is they're paid for 3 years. After the 3 years, then they continue to cover and take care of you, but they don't get paid for the additional 2 years. So you're on a 5-year contract and you are covered during that 5 years. However, if you are, say you're 2 years into your contract and you decide that you want to switch companies, you have to find another vendor that will pick you up on that same contract, knowing that they're only going to get paid for 1 more year. So it's advisable to decide early on, I'd say like within the first 6 months that you go under contract for your oxygen, to decide if they're the ones that you want to stay with. Because Medicare they don't reimburse for the full 5 years. I know that's a little confusing, but all right, so types of oxygen systems, and I'll talk about all of these except for the liquid oxygen, which is the one in the bottom left-hand corner. We don't really have that in Vermont. I've only seen like 1 or 2 people, and they were in southern Vermont that had this type of system. I know we used to have it a lot in Colorado, and I think it's just the cost of the system, which is why most of these companies don't provide that for people. But what we do have is we have concentrators. So this guy in the top left is a home unit type of concentrator. You can see it's got the wheels on it. It's got your flow meter right here. You can attach humidity to this in the form of what we call like a bubbler. So if you're someone who deals with dryness in your nose or sinuses, you may want to ask about getting a humidifier. This looks like a black suitcase in the middle. This is a portable concentrator. So this is the kind that you've probably seen on TV that you just kind of strap over your shoulder, you put in a backpack, and it's got batteries inside, and that's how you are portable with the concentrator. And then here we have a transfill station. So again, it's the stationary concentrator, and then on top you have the refill unit. So this is those small aluminum tanks that you can refill on your own at home. And then of course we also have regular tanks. So these have been around forever, and this is, for some people, this is the best system for them to use, especially, they're gonna be the lightest, and then the bigger ones will be able to provide the highest liter flow or the highest amount of oxygen. All right, so concentrators. So these are devices that make the oxygen inside of the machine. So they provide, the home stationary ones provide continuous flow of oxygen And you don't need tanks. You don't have to be worried about refilling the oxygen. As long as you have a power source or the battery, if it's a portable one, um, they basically, how they work is they take in the atmospheric air and they scrub out the nitrogen and they concentrate the oxygen so that when you breathing, you're getting that concentration of just the oxygen. Um, and then with these, it also just kind of changed the way we could deliver oxygen to people, because then we weren't relying on, big tanks and things like that. So this is, as I mentioned in my other talk, kind of help with the growth of pulmonary rehab, because once we realized we had these type of machines that could make the oxygen for us, everything became much easier. You could have oxygen in the home easier. You could participate in different exercise programs because you could have your continuous oxygen. This is just a little bit more insight into, the technical aspects of a concentrator. I'm not going to get into too detail on that, but just know that's kind of how it works. Some people have wondered, do they remove the oxygen from a room? No, you don't need to worry about that. There's plenty of oxygen in the room if you are in the same room as a concentrator. They will increase your electrical bill, and then that is tax deductible. So just be aware of that. You can also call your power company and let them know. You should call your power company and let them know that you're on oxygen. And then if you've been on the same concentrator for a long time and you notice your electric bill jumps, you should check with your company and see if they have a newer model if you've been on the same one for a while. Same if it's, making really loud noises. They do make noises. There's that normal kind of dump sound or like a release sound. That's normal, but sometimes the older models can be really, really noisy. Okay, so if you have one of those home unit concentrators, which most people do, you have to have portable tanks in your home in case the power goes out. So that's your backup system. And those usually are delivered when you get your oxygen initially. And they are these giant tanks that most people don't like them in the house. They can take up a lot of space, and they usually find like a closet or somewhere to keep these tanks, which are your backup in case the power goes out. And then I had mentioned this already, make sure you let your company know that you are on oxygen so they can make you a priority if you were to lose your electricity. All right, so why is the concentrator the preferred source? So it provides an unlimited supply as long as you have that power to run it. You don't have to refill it. It can be moved from room to room. It's got the wheels. Some of the portable units can be recharged in your car. Really, there's not a lot of maintenance required with these. And then the smaller portable units, some of them are FAA approved, not all of them, but the ones that have interchangeable batteries you can fly with. All right, so warnings with the concentrator, you definitely don't want to place this in a small area. So I had a patient one time tell me that his concentrator was so noisy, it was keeping him up at night, and so he decided to put it in the closet. That's not a good idea because they put out heat. So you want to make sure that they are well ventilated. You want to make sure that they're not in an area where they could get tipped over. They give you lots of oxygen tubing. So if that were the case with that patient, the best thing he could do is to move the concentrator into maybe another room and then run the long oxygen tubing into his bedroom so he doesn't hear it as much. You want to make sure that you keep your filters clean and follow any guidelines on maintenance that your company has recommended that you do. They should come and service your machine, I believe once a month is how most of them service it. So double check with them if you have any questions on the maintenance of your machine. All right, going into our portable oxygen concentrators, sometimes you might hear P.O.C., that's what that stands for. So they range in weight from 5 pounds to 20 pounds. Be careful with what you hear on the commercials on TV, because sometimes that information is misleading. Um, I know they are getting lighter and lighter, but typically when you have the concentrator and the battery in it as well, it's usually around 5 pounds. These ones that advertise 2 pounds or something like that, it's probably the weight of the unit without the battery in it. The larger units can offer that pulse dose, and I'll talk about that in a minute. And some of the larger ones have continuous flow. So depending on what your oxygen settings are, if you need more oxygen, more being like greater than 2 liters, then you may, if you're going this route, you may have to get a larger machine. And the bigger they get, they will provide a cart. They'll be on wheels so you can pull them and you don't have to lift them up, because some of them can weigh up to like 20 pounds. The smaller units are usually limited to pulse dose only, meaning you can't get that continuous flow. So the smaller they are, the smaller the battery, the less power they have to create a larger amount of oxygen. So usually these are around, like if you're on 2 liters, 2 to 3 liters, maybe max, you could get like a smaller unit. So their primary limitation is that battery life. Sometimes people purchase extra batteries so that they can make sure that they don't run out. You have to be really smart about where you're going, how long you're going to be out for, where can I recharge my machine, things like that. And then the ones, as I had said earlier, that have those interchangeable batteries, they're the ones that you can typically fly with, but definitely check to make sure before you show up at the airport, and we'll talk more about that later. So just understanding, as you need more oxygen, they're going to get bigger and heavier. If you're still on, that 1 to 3 liter range, you might be able to get by with the smaller units. And then you also have to think to the future, because you don't know what your body is going to need, a year, 2, 3 years from now. So going for one of those super tiny light ones that can barely keep up with your needs right now may not be the best decision. You have to think, going forward, especially if you're someone who's going to be purchasing one of these machines. All right. Real quickly, I'm going to talk about, since I just started talking about purchasing your own machines, and I think I forgot to mention this in the Medicare part, is that your insurance will only pay for one type of portable system. So when you go to your company and they are helping you with that decision, you have to decide, do I want a portable oxygen concentrator or do I want tanks? You can't have both. So that's decision number one with portability. And there are pros and cons to both. I can't say that one is better than the other. It just depends on how you want to look at it, how you want to plan. Do you want to plan to have more tanks to keep you going, or do you want to plan around battery life? So I think that's good to understand. What some people end up doing, say they decide that they need the larger tanks, like we say like an E-tank would be a larger size for portability. Sometimes they let their insurance cover the tanks and then they purchase their own portable oxygen concentrator. And so if you own it, they're not going to come out and service it. So if you're purchasing it directly from the manufacturer, you definitely want to make sure you have good coverage as far as the warranty goes if you're purchasing your own. Okay, so these P.O.Cs, some people find them very helpful. They can, like I said, you can charge them different places. You can do air travel. If you are busy around your house, you can usually find a backpack, throw it on your back, do your thing, especially if you're cleaning and things like that, so that you're not tripping over your tubing. They can be easier to use for people who have fine motor deficits. So like with a portable oxygen concentrator, you're just pushing buttons. You're not dealing with a regulator in a tank. So if you have issues maybe arthritis with your hands, things like that, it might be easier to use. Um, Somewhat non-medical appearance. I mean, they don't look like a tank, but you still have a cannula in your nose. So it just kind of depends how you look at it. Some limitations is that not all the providers have all the most current, up-to-date, fancy machines. You might get one that's a little outdated because that's just what they have available if you're getting it through the DME provider. And then there is this on-demand setting, which I'll talk about that in a second. And then they don't have oxygen sensors, like they can't tell you exactly how much oxygen you're getting, and that will make sense here in just a second. Okay, so I'm gonna go over tanks real quickly. So tanks are, as most of you know this already, but they're basically compressed oxygen placed inside of this usually aluminum cylinder. They have a flow meter or regulator that's attached, so you can adjust the flow rate. The larger you go, the more oxygen they can provide, and then they have super, super tiny ones that are like maybe a little bit bigger than my mug here, and they're very portable. You can put them in a backpack. You just have to make sure you have enough of them maybe in your car to get you out doing what you want to do. So a lot of people think tanks aren't as good as a portable oxygen concentrator, but I don't think that's the case. I think if you're smart and you know how to manage the quantity of oxygen, I think these can work just as well for people. All right, so they are the oldest. They've been around forever. They're pretty common for portable use. They're lightweight. Big ones, big cylinders are made of steel, and then they're packed at 2,300 to 2,500 pounds per square inch. So that's the pressure inside of the tank. That's where you just have to be careful. I hate to use the word dangerous because I don't want people to think that they shouldn't use tanks. But there is a lot of pressure inside the tank. So you don't want to be taking a hammer and knocking off the top of it. I know there's a Mythbusters that they do that. So avoid doing something crazy like that, unless you're on Mythbusters. But let's see, options and limitations. I said this, larger tanks last longer, but they can be harder to manage because they're bigger. Smaller tanks are pretty lightweight, easy to manage, but you just have to keep an eye on your regulator and know how long they're going to last you. So that's a great picture. You can see all sorts of shapes and sizes down there. All right, going back to the transfill system. So I know some of you use these systems where you don't have to depend on the company to bring you the tanks. You can just fill your own right there in your house, which is great. They do take a little while to fill, so again, you have to plan ahead. Pretty much if you are using oxygen, it does require a lot of planning. So make sure you get your system, make sure you ask for help and figure out how things are gonna, you can make things work for you. Let's see, these can be pretty small. The thing with these is that it says it's lower purity grade oxygen. So I just see that as it's fine, it's enough oxygen, but it's not the same as if, you came to Pulmonary Rehab in person and you were using one of our tanks. That's going to be like a higher grade percentage of oxygen. But these still do great. They work really well for people. Okay, so pulse systems or oxygen conserving devices. So you will see these sometimes on the smaller tanks, and then also with a smaller portable oxygen concentrator. So what this means is that we want to conserve, if you're with a tank, we want to do our best to conserve the oxygen that's in that tank. So it's not just blowing out into the air if you're not using it. So these pulse systems are designed so that it senses when you inhale through your nose, and it'll give a pulse of oxygen. So if you're not breathing through your nose, guess what? You're not getting your oxygen. So if you're a mouth breather and you feel short of breath and you know you've turned your oxygen on and you're turning it up, check your pulse oximeter, see what your oxygen levels are, make sure that you're sniffing, getting that oxygen in. And that goes for both systems. That goes for portable oxygen concentrators and for tanks as well. So these work great. You know, your company will test you first to make sure you have enough of an inspiratory force to trigger the device. That's definitely something that's important to understand, and that usually needs a doctor's order in order to be tested to use one of these devices. So some do have the option of running continuous flow, and I think that's more on a tank type of system, but usually the continuous flow is maybe at max at like 2 liters per minute. So if someone were using this conserving device and they felt like they weren't getting enough oxygen, you can flip it to continuous and you'll get that continuous flow. But you use up more oxygen when you're on continuous flow. So it's only going to run when you inhale through your nose, it shuts off when you exhale, and it can help the cylinder last for 3 to 6 times longer than if it were just running continuously. And I had mentioned this, they don't work well when you breathe through your mouth. The number on these devices is not necessarily the liter flow. So you guys probably understand already when we titrate how much oxygen you need, especially at your doctor's office, they're giving you a measurement in liters per minute. So that's how many liters of oxygen are coming out of that tank per minute. So say you end up with 2, you're supposed to use 2 liters per minute. When you go to one of these conserving devices, whether it's the P.O.C. or the tank, those numbers are not necessarily the same. So a setting of 2 on your concentrator or your tank does not necessarily mean that it's 2 liters per minute. Because it's going to vary depending on the machine. It's going to vary depending on how fast you're breathing, how deep of a breath, how shallow of a breath are you taking. So it's not the same thing. So good to understand that. If you change devices, say you get a different portable oxygen concentrator, you definitely want to be checked again and make sure. So that's where the pulse oximeter is your best friend. You know I mentioned that before, but really if you are on oxygen, I can't recommend high enough that you should get a pulse oximeter. I think that's going to be the best way to monitor. Okay, so some safety things with tanks. You always want to make sure that they are secured safely. Again, there's a lot of pressure in those, so you don't want to be knocking them over. Don't store them in an area with flammable liquids. Let's see, you don't want to break the valve off, all things like that. So they should be stored in either a rack like that on the left or maybe even a cart like that on the right. If you're traveling in your car, again, we'll go over this more, but you want to make sure everything is tied down. You don't want your tanks rolling around in your trunk. So make sure you pay attention to how you have these things secured in your car. That person is definitely ready for a major road trip, and I hope that they don't get rear-ended. All right, so other safety with oxygen itself. You don't want any open flames around the oxygen. So oxygen itself is not just going to ignite, but it does support that combustion. And then, of course, the more oxygen that's available, the larger the fire, the more it'll spread. Oxygen tanks are under a lot of pressure. You don't want to knock it over, knock the top off, or it can take off like a rocket. Liquid oxygen is very cold. You can sustain frostbite if you touch it. I really don't need to say this, but don't ever smoke with using oxygen. There are people who do. You know, I used to work in a burn ICU, and we would see people come in with the burn marks from their nasal cannula from using oxygen and smoking. Just don't do it. You know, I'd rather see someone have their oxygen off to the side and then they walk over if you really need that cigarette. Just don't do it. Oxygen safety. So these are things that not everyone thinks about. If you're a griller or you have a gas stove, you can't be around those flames if you're using oxygen. You want to keep at least a 10-foot distance from all those things, which is a bummer, but you know, it's just not worth the risk. I've known people who've had to switch out their stoves and they go to an electric stove because of those reasons. You don't want to use grease or oil on your equipment. You know, try and stay away from things like Vaseline and other lubricants. Aerosols can also be flammable. The oil-based creams, try and use water-based creams, even a hair dryer or an electric razor. I mean, I know people don't like to hear this and they still use their hair dryer and they still use their electric razor, but anything that can create a spark can cause things to ignite, so be careful. The other thing is the oxygen tubing. So you know, if you're on oxygen, I know you can definitely relate to, like, you know, the 25 to 50 feet of tubing that accumulates around your house. So you definitely don't want to trip on that. So be very careful, be aware, keep it organized, keep it coiled up as best as you can. Don't try and fix your own equipment, never a good idea. There are the basic things like changing your filter and stuff like that, but call your company if you're having issues with your equipment. Make sure your smoke detectors are working, check them monthly, have a fire extinguisher, know your escape route. Let your fire department know that you're on oxygen, and your gas and electric companies as well. All right, so I am going to skip that one because I think I talked about this in our last lecture. Oxygen is not addicting, right? Just as a review, we all need oxygen. But do remember that oxygen is the only drug that can be prescribed for a person with chronic lung disease that will lengthen your life. All the other medications will just make you feel better. So I can't say it enough. If you are told that you need to use oxygen, it is extremely important that you figure out the best way to use oxygen, to find the systems that work for you, ask for help. And you know, my last little lecture soapbox kind of spiel is that if you're told you need oxygen with exertion, that means if you come to pulmonary rehab and you park in the middle of the parking lot and you have to walk all the way into the front desk, that time when you're walking is exertion. So use it. Don't just leave it in the car. If you're going to the grocery store, use it. If you're walking your dog, use it. For some people, it's worth checking your pulse oximeter even at your house. So even if you get up from your living room, from your couch, and you have a long hallway to walk down to use the bathroom, your oxygen might be dropping just in that short distance. So check your pulse oximeter, especially if it's 88 or less, then you need to use that oxygen. All those little increments, they count. Your body definitely will feel and potentially start to exhibit signs of not having enough oxygen if you really push it too much. So use your oxygen the way you're supposed to. If you have any questions, let me know. I'm always happy to discuss this more. It's a sensitive topic because when you're first told that you need to go on oxygen, it can be really, really hard to just take all of that in. So be kind to yourself, ask questions. There's plenty of people out there in this world using oxygen. They are climbing mountains, they are riding bikes, they are doing all those things that they want to keep doing. So don't give up hope and let us know how we can help you. All right. Thanks for watching and take care. We'll be in touch soon.